Hello, this is Yang Chen. I'm going to do the Capuject injector video for the nursing class, Nursing 130. So first I get all my supplies. Also, I'm going to get the medication through the Paxis. So the medication I'm going to do the injection is morphine 1 milligram through the IV push. So what we have in the Paxis is morphine 2 milligram in 2 ml, and the expiry date is 2030, so the medication is good. Um, After I get the medication, check with the mom, I take the medication to the preparation room. So I put it in the Capuject here. I'm going to waste the 1 milligram with my coworker on my side because it's a controlled medication. Okay, so I twist it here. I'm going to waste the 1 milligram here. Then I will ask my coworker to check. It's 1 milligram left here. So I'll put it back and take this medication to the patient's room. Of course, when I disregard the medication, I did a second check while we were preparing for the medication. Then I go to the patient's room, do the third check at the bedside. So it's a morphine 1 ml through the IV push. When I go to the patient's room, I will check for the medicine allergic, make sure the patient not allergic to this medication. Also, I will do the two identifier patients check, the name and the date of birth, make sure it's a red patient. Before I administer this medication, I check the drug book. I'm supposed to give this medication 1 milligram in 2 minutes. In this case, I should inject the 0.25 in 30 seconds. Also, before I give the medication, I also need to check the patient's sedation level, the pain level, and the respiratory rate. After this all done, I will go ahead to the hand hygiene, wash my hand, then wear the gloves. Before I administer the medication, I will assess patient's IV side to see whether there is redness. And redness, I will also ask the patient whether there is any pain here. Also, I will check whether there is filtration and edema around the area and palpate it lightly. Then after that, I'm going to use an alcohol swab to clean the IV portion for about 15 seconds. Then I will go ahead and use the IV push to flush it before I give the medication. I will check whether it's always clamped, so I need to unclamp it first before I do it. So I will draw some blood to check the IV competent. To draw, I will see the blood return. Then that means this IV is good. Then I will go ahead and flush about 5 ml. Okay, so after this, I will get my medication ready here. Because this size is about 0.5, so for the first push, I will do about 0.75. Then I wait about 13 seconds. Then I do the rest of 0.25. After this, I will wait about 30 seconds and put this IV push back on. to push the rest of the medication to the patients. So do 0.25, then wait 30 seconds. Then do another 0.25, wait 30 seconds. In this case, all the medication already go to the patient. Then I will push the rest of the normal saline to the patient. Okay, before I push all the thing, I will get the IV clamp ready and make sure there is no air go to the patient side as well. Okay, I will go ahead and clamp it to make the positive pressure here. Okay, now I will put a cap on the patient to protect the IV size if based on the hospital policy if they have the cap. So I will leave it here and tell the patients I will be back about 20 or 30 minutes to assess whether the medication is effective. Also, I will check the patient's sedation level and the respiratory rate to make sure patient's good.